Links? We say we follow the data. But what happens when the data never included you to begin with? Today, we're talking about the people missing from the charts, the lives not captured by the numbers, and what it means for the future of public health. Quick stat. Nearly 150 million Americans live in federally designated mental health professional shortage areas, HRSA, 2023. When AI tools are trained mostly on urban insured populations, these rural and underserved communities risk being left out of algorithm-driven healthcare. We say we follow the data, but what happens when the data never included you to begin with? Imagine a world where your story is invisible. Imagine a world where your struggles are invisible. Imagine a world where even your health is invisible, simply because no one ever counted you. Today, we're talking about the people missing from the charts, the lives not captured by the numbers. Links? What it means for the future of public health. Let's start with a staggering fact. Black women are 3 to 4 times more likely to die from pregnancy-related causes compared to white women in the United States. Yet, until recently, most major national data sets didn't even break down maternal outcomes by race. Think about that for a moment. How can we solve a crisis we refuse to see or even measure? This isn't just about numbers. It's about real people, real consequences. Hence, the silent harm caused when entire communities are left out of the conversation. In this episode, we'll uncover the hidden costs of invisible data, why including everyone in the numbers is a matter of life and death, who exactly is left out when the numbers don't add up. Let's put faces, real or imagined, on the people lost in the data gap. Start with undocumented people. Many live in fear of being counted, worried sharing information could put families at risk, skipped in surveys, missing from health registries, left out of studies, vaccine rollouts, emergency response plans. Then there are unhoused populations. Without a fixed address, they're rarely reached. Shelters, cars, the streets, untreated infections, mental health struggles. Let's talk about rural communities. Health workers may visit just once a year, if at all. Lack of infrastructure and resources to count them. Data deserts, places without recognition. LGBTQ+ youth often go uncounted, especially where stigma or discrimination make it unsafe to be seen or heard. Higher rates of anxiety, homelessness, suicide risk, and then Black and Indigenous mothers. Their maternal health outcomes weren't tracked accurately for decades. Until 2020, the United States had no reliable national data on maternal mortality. Death certificates used inconsistent codes and categories. The true scale of who was dying and why remained hidden. Data deserts aren't accidental. They result from systems that decide who matters and who doesn't. Missing recognition, missing resources, missing opportunities to save lives. Think about who's not in the numbers and what it would mean if they were. Welcome to Tomorrow's Consciousness. I'm your host, Rukiya. Before we begin, just a quick disclaimer. The views expressed in this podcast are for informational purposes only and do not constitute medical or legal advice. Please consult with qualified professionals for specific guidance. Today, we are diving into a topic that affects every single one of us. We are talking about the unseen, the uncounted, the invisible millions. These are people who exist in our communities, in our cities, and in remote corners of the world. Yet they are completely absent from the data that shapes our health policies. They are ghosts in the machine of modern public health, and their absence has profound, life-altering consequences for everyone. Think about the numbers you hear on the news every day. Disease outbreaks, vaccination rates, life expectancy, chronic illnesses. We trust these numbers. We rely on them to make critical decisions. Governments allocate billions of dollars based on these figures. Scientists develop new treatments based on this data. Doctors advise patients based on the patterns they reveal. But what if I told you that these numbers, the very foundation of our public health systems, are built on incomplete, biased, and sometimes dangerously flawed information? What if the data is telling only part of the story, leaving out entire populations? This isn't a minor error or a small statistical oversight. We are talking about millions upon millions of people. They are the homeless living on our streets, the migrant workers moving from one temporary job to the next, the indigenous communities in remote territories, the elderly who live in isolation. They are people without official identification, people who fear interacting with authorities, right? Or people who simply live in places where data collection is a forgotten luxury. When these individuals are not counted, their health problems do not officially exist. Their suffering is rendered invisible, their needs are ignored, and the system designed to protect them fails them completely. When a community isn't represented in health surveys, a local outbreak of a preventable disease can go unnoticed until it becomes a full-blown crisis. When a specific ethnic group is missing from clinical trial data, a new life-saving drug might be ineffective or even harmful for them. By leaving millions out of this narrative, we are not just creating statistical inaccuracies. We are perpetuating cycles of inequality and injustice. We are making decisions that are skewed, policies that are misdirected, and ultimately, a world that is less healthy and less fair for all. Let's paint a clearer picture of who these invisible people are. Imagine a bustling city, a metropolis gleaming with skyscrapers and advanced technology. Somewhere in the shadows of those buildings, a family lives in an unregistered settlement. They have no formal address, no legal status, no access to basic services. When a health surveyor comes to the neighborhood, their dwelling is overlooked. It doesn't appear on any official map. For all statistical purposes, this family does not exist. Their children may miss vital vaccinations. A chronic illness in a parent may go undiagnosed and untreated simply because the system has no record of it. Now, let's travel to a remote, mountainous region in a developing country. Here, a small indigenous community has lived for centuries, maintaining their unique culture and traditions. They are geographically isolated. The national government has limited infrastructure in the area. Health workers rarely visit. Data collection efforts are sporadic at best. When a global pandemic strikes, resources are allocated based on population data from major urban centers. This remote community receives little to no support. Their vulnerability is completely off the radar. They are left to fend for themselves against a threat they are ill-equipped to handle. In recent years, a powerful new tool has entered the public health arena: artificial intelligence. AI promises to revolutionize everything. It can analyze vast data sets at incredible speeds, identify patterns that humans would miss, and predict disease outbreaks before they happen. Proponents tell us that AI can create more efficient, personalized, and effective healthcare for everyone. Imagine an algorithm that can scan satellite imagery to identify communities at high risk for malaria, or an AI model that predicts a city's hospital bed shortages. The potential is immense, offering a future where disease is managed proactively. But here is the shocking truth, the central paradox of our story today. The very same AI that promises to save us is also at risk of making the problem of the missing millions even worse. Artificial intelligence is only as good as the data it is trained on. And if that information is biased or incomplete, the AI will learn and amplify those biases. This creates a dangerous feedback loop. An AI model trained on data from affluent urban populations might develop health interventions that are completely unsuited for rural or low-income communities. In essence, AI can take the existing inequalities in our data and bake them into the automated systems of the future. The peril is that we will place our trust in these seemingly objective, intelligent systems without realizing they are perpetuating old prejudices on a massive, unprecedented scale. The machine, in its cold logic, will simply make the invisible even more invisible. We're here today on Tomorrow's Consciousness. It is a quest to give a voice to the voiceless and to make the invisible visible. In this series, we will peel back the layers of data, technology, and policy. We will hear from experts on the front lines, and more importantly, we will hear the human stories of those who have been left behind. We will explore how these data gaps are created, who is most affected, and how the rise of AI could either deepen this crisis or, if we are careful, help us finally solve it. To understand how millions of people become invisible, we must first dissect the anatomy of a data gap. It begins with the most fundamental act of being counted: civil registration. In many parts of the world, getting a birth certificate is not just a simple administrative task. It is actually a significant hurdle. For families living in extreme poverty or in remote, hard-to-reach areas, the cost and travel required to register a newborn can be, well, pretty prohibitive. Without this first official document, a child is born into a state of invisibility. They have no legal identity, which is the gateway to education, healthcare, and social protection. The problem then extends from birth to everyday life. Think about how most health data is collected. But what about those who live on the margins? The migrant worker who moves with the seasons, the homeless individual who has no permanent address. These populations are in constant motion or live outside the traditional household structures. They are systematically undercounted, not out of malice, but because the systems themselves are just not built to see them. Furthermore, even when people do interact with the healthcare system, their data might not be captured accurately or completely. In more technologically advanced settings, different software systems may not be able to communicate with each other, in creating these siloed pockets of information. A patient's history from a community clinic might not be accessible at a major hospital, leading to fragmented care and incomplete records. This technological disarray means that a holistic and accurate picture of their health journey is often impossible to assemble, creating yet another layer of data invisibility. Finally, we have to consider the very design of our health surveys and studies. Surveys are typically conducted in dominant languages, immediately excluding linguistic minorities. They're designed around cultural norms that may not apply to all groups. For example, questions about family structure or diet might be confusing or irrelevant to certain communities. When a survey is not culturally sensitive or accessible, the responses will be skewed, or worse, entire groups will opt out of participating altogether. This is how a data gap is born. Logistical barriers, systemic design flaws, social exclusion, and technological fragmentation that together create a world where millions are simply not counted. Technology is often hailed as the great equalizer, the tool that will lift the invisible into view. But what happens when artificial intelligence built on incomplete or biased data becomes the new gatekeeper? Let's look at how AI models trained on flawed datasets are already shaping decisions that impact millions. These algorithms drive resource allocation, they drive disease tracking, they drive public health investments. But when the underlying data is missing entire communities, the predictions go off course. Take the COVID-19 pandemic. Across many cities, authorities use census data to decide where to place testing sites. Census counts often miss people living in overcrowded apartments. They miss people in informal settlements. They miss people without stable addresses. The result? Testing centers were set up in neighborhoods that looked good on paper, but in reality, many of the highest risk communities were left out. Empty testing booths in affluent districts, long, snaking lines in overlooked neighborhoods. This isn't just a one-off mistake. When algorithms don't see the full picture, they reinforce existing blind spots. AI-driven disease surveillance might miss outbreaks among undocumented migrants. It can fail to track chronic illnesses in the homeless population. Why? Because these groups are undercounted. The technology is only as fair as the data it learns from. When the data is biased, AI amplifies those biases, sometimes with life or death consequences. As we rely more and more on data-driven systems, the invisible millions risk falling even further into the shadows. The promise of AI is powerful, but without a commitment to more inclusive, accurate data, that promise will remain out of reach for those who need it most. To truly understand what it means to be invisible, we need to move beyond statistics and look into the eyes of the people left behind. Let me tell you about Maria, a name we're using to protect her identity. Maria traveled hundreds of miles, leaving her small village with her 2 young children, hoping to find work in a bustling capital city. She is one of millions of internal migrants who fuel the economies of our cities, and yet she remains completely off the official grid. She found work as a cleaner, paid in cash, and lives in a single room in an unregistered settlement on the city's periphery. This settlement appears on no official maps. For the city's administration, Maria and her entire community do not exist. When her youngest son, Leo, developed a persistent rattling cough and a high fever, Maria faced an impossible choice. She knew he needed a doctor, but the local public clinic required a proof of address and a national ID card, neither of which she possessed. The fear of being evicted, losing her job, or even being forcibly sent back to her village was paralyzing. Desperate, Maria took Leo to an informal doctor, a pharmacist in a nearby market, who sold antibiotics without a prescription. What she didn't know was that a new drug-resistant strain of tuberculosis was quietly spreading through her unregistered community. A health crisis completely invisible to the Ministry of Health. Her son's illness is not just a personal tragedy. It is a failure of the entire public health system, a stark reminder that when we fail to count someone, we are denying their humanity. Now let's turn our attention to the streets of our own cities. Here we find another group of missing millions, people experiencing homelessness. Take the example of John, a 55-year-old man. He now lives in a tent under a highway overpass. He has no fixed address, no phone. His official identification was stolen months ago. John suffers from diabetes and high blood pressure, but how can he manage them? He has no stable place to store insulin. He often relies on emergency rooms for care, a costly and inefficient solution that only addresses immediate crises. In the eyes of the data, John is not one person with a chronic illness. I think he is a series of disconnected, expensive emergency events. The system sees the symptom, but it never sees the man. Imagine an AI model designed to predict hospital readmissions. When the AI analyzes John's case, it might flag him as a low-risk patient. The algorithm, blind to his reality, cannot comprehend that discharging him back to the street is a near guarantee of a future health crisis. Let's journey far away from the city to the forgotten frontiers where the digital divide is a canyon and healthcare is a distant dream. In this village lives a young woman named Ananya. She is pregnant with her first child. The nearest clinic is a 6-hour walk away. When the government launches a maternal health program using a mobile app, it is a complete non-event for Ananya and her community. They have no smartphones, no internet signal. This lack of data has life and death consequences. Official data shows 0 recorded pregnancies, so no resources are allocated for maternal health. When Ananya goes into a difficult, prolonged labor, there is no emergency transport to call, no trained professional to help. An AI-driven public health model might even recommend closing the distant, underused clinic. The logic of the machine would further strip resources from the areas that need them most. Technology will not be a savior. It will simply be a more efficient way of forgetting. The core of the problem is a simple, yet devastating domino effect. Bad data hits flawed analysis, misguided policy, wasted resources. Think of public health policy as building a house. The data is the foundation. If you build on a cracked foundation, a government might use flawed data to decide where to build new hospitals. So they build yet another state-of-the-art hospital in the city, while millions in the periphery are left without even a basic clinic. An AI might analyze data from a fitness app and conclude that the primary public health challenge is encouraging people to run more marathons. The AI has not solved the problem. It has provided a sophisticated justification for ignoring it. The final domino to fall is the human cost. These are not random accidents. They are predictable outcomes of a system flying blind. It's kind of like an army commander being given a faulty map of the battlefield. The commander, trusting the map, directs all their troops and resources to the north, leaving the southern flank completely exposed and vulnerable. Consider the global focus on non-communicable diseases. The data, gathered largely from more developed nations, shows a massive and growing burden from these conditions. However, the data landscape systematically undercounts the enduring threat of infectious diseases. Tuberculosis, cholera, malaria, measles continue to thrive in places where data collection is weakest. Because these outbreaks are underreported, their significance is downplayed. Funding for infectious disease surveillance and control can stagnate or even be diverted. An official report might proudly announce that 95% of children have received their essential immunizations. If you were to include these uncounted millions, the true vaccination rate might be closer to 70%. This illusion of progress is particularly tempting for politicians and policymakers. It is much easier to celebrate the misleading 95% figure than it is to acknowledge the difficult and expensive truths. Over time, these falsely optimistic numbers become the accepted reality. This creates a powerful institutional inertia. The ultimate danger of this illusion is that it breeds complacency. We defund the very programs that are needed to reach the last mile, and the price for our self-deception is paid by the most vulnerable. After exploring the darkness of data gaps, it is easy to feel overwhelmed. But this is the moment in our journey where we turn towards the light. A new generation of public health pioneers is championing methods like community-led surveys, where local residents are trained and empowered to collect data within their own communities. Organizations like the humanitarian OpenStreetMap team use satellite imagery and a global network of volunteers to literally put forgotten communities on the map. When people are involved in the process of being counted, they gain a sense of agency. The data is no longer something that is taken from them, but something that they own and can use to advocate for their own needs. The key is to empower trusted local figures, the community health workers, who can bridge the gap between the system and the people. They become the human interface for the health system. This can be achieved by creating safe zones for healthcare, where individuals, regardless of their legal status, can receive care without fear of being reported to other authorities. Instead of being passive recipients of aid, communities become active partners in their own health. They help define the problems, collect the data, and design the solutions. The same artificial intelligence that risks amplifying bias can become one of our most powerful allies in the fight to count everyone. AI can also actively identify and correct for bias. It can flag underrepresentation. Algorithmic auditing acts like an automated conscience, forcing researchers and policymakers to confront blind spots. AI-powered language tools to break down communication barriers. Chatbots can interact via simple text messages. This lets us reach people on their own terms with simple, accessible technology. In this vision, AI becomes a bridge, connecting the disconnected and giving a voice to those who have been unheard. Fixing the data gaps is not just a technical challenge, it is, at its heart, a political one. This policy blueprint must begin with investing in the foundations of visibility, civil registration, and vital statistics systems. Having a legal identity from birth is the first step out of invisibility. Furthermore, we need to create policies that explicitly demand data disaggregation. This simple act of disaggregation makes inequality impossible to ignore. The fight for inclusive data is the civil rights issue of our time. It is a fight for the principle that every human life has equal value. Counting everyone is not merely a technical challenge. It is a moral imperative. It is the ultimate measure of our humanity and our commitment to justice. The right to health is a universal human right, not a privilege reserved for those who are easy to count. When our public health systems fail to see a person, they are implicitly stating that some lives matter more than others. This is a logic that we must reject with every fiber of our being. Think back to the stories we heard, the fear in Maria's heart, the quiet desperation of John, the profound isolation of Ananya. The scale of this problem can feel daunting, but the journey to count every single person begins with a shift in our own consciousness. This act of critical awareness is the first step in a chain reaction of change. It is the spark that can ignite a movement. We are all architects of tomorrow. The future of public health is not something that will happen to us. It is something we will build together through our choices, our actions. This is the spirit we must carry forward. Blend the wisdom of notebooks with the power of modern technology. Be well. And remember to look for those hidden in the shadows, where our shared humanity is truly tested. Thank you for joining me on Tomorrow's Consciousness. I am your host, Rukiya. Before we close, let's take a moment to ask, why do so many people remain invisible in official systems? The answer isn't just about missing paperwork or broken infrastructure. Behavioral science reveals a deeper truth, one rooted in the lived experiences of millions. For some, signing up for an official record is not just a bureaucratic step. It's a leap of faith. Stigma. Fear of surveillance, memories of past trauma. In communities with histories of discrimination or neglect, mistrust runs deep. Sometimes the very act of being counted feels risky. Health literacy plays a role too. If people don't understand why their data is being collected or how it will be used, they may hesitate to participate. Informed consent isn't just a formality, it's a bridge to trust. When that bridge is missing, invisibility often becomes a form of self-protection. But there are ways forward. Around the world, communities are experimenting with participatory data collection, inviting people to share their stories on their own terms. Storytelling, peer-to-peer interviews, community-led surveys. These approaches honor lived experience, foster trust, and create space for voices that have long been silenced. If we want to close the data gap, we must look beyond numbers and see the people behind them. By weaving together behavioral science, cultural understanding, participatory practices, we can build systems that are not only accurate, but also compassionate and just. This is the next frontier in the quest for inclusive data, a journey of empathy, humility, and partnership. Thank you for listening and for being part of this movement toward visibility for all. Why do people avoid official systems? For many, stigma, fear of surveillance, and past trauma make official systems feel unsafe. These barriers are often invisible but deeply influential. Cultural mistrust plays a powerful role. Historical abuses, discrimination, and broken promises have left many communities wary of sharing information with authorities. Health literacy is another key factor. If people do not understand why data is collected or how it will be used, they are less likely to participate. Informed consent is essential. People need to know their rights and have control over their own data. Without trust and transparency, participation drops. Participatory data collection offers a solution. When communities are involved in gathering and interpreting their own data, trust grows and the data becomes more meaningful. Storytelling is another powerful tool. By sharing personal experiences, people can make invisible struggles visible and inspire change. As we reach the end of this journey, one thing is clear. Data is never just numbers. It's the heartbeat of communities, the stories of individuals, the foundation for a more just world. By shining a light on the invisible and understanding the human side of data, we move closer to systems that serve everyone, fairly and compassionately. But our work doesn't end here. In our next episode, we'll explore how new technologies and grassroots movements are transforming the landscape of data inclusion. Digital ID innovations, local advocacy campaigns. We'll meet the change makers building bridges. One story, one policy, one breakthrough at a time. So stay tuned. The path to visibility is unfolding. Together, we can make sure no one is left in the shadows. Thank you for watching. See you in the next chapter. If we don't count people, they don't count. But they should. And in tomorrow's public health systems, they must. What if your social media was quietly being used to detect public health risks?